The typical recovery time from a one-level XLIF is usually in the range of about 6 to 8 weeks. Certainly you're not in the hospital that long. Usually you're in the hospital 1 or 2 days. You're up walking the very next day. But since bone grafts are involved, and many times a bone fusion is compared to a healing fracture. Most healing fractures take about 6 to 8 weeks to heal. Same with a bone fusion. Sometimes it takes even longer, depending on other factors such as the patient's age, their health. So it may take as long as 12 weeks, but I would say in the range of 6 to 12 weeks for a healing of a fusion. Well, I think it's always important for patients to know ahead of time and to understand that going through the psoas muscle during the procedure, there are certain nerves there that can get stretched, and there may be a period of thigh numbness or even significant weakness that they'll experience afterwards, and not to be alarmed if that does occur. I've seen that happen many times, and it always, at least every time I've seen it, it resolves. It may take 6 weeks or maybe even longer, but in most cases it resolves faster than that. The other thing that could happen is that if a patient has soft bones or osteoporosis, the cages may sink into the vertebra a little bit, and if it sinks enough or shifts, it may require a second surgery later to put in stabilizing rods and screws. But that doesn't happen in every case, but it could happen, and it's just something to be aware of. Well, there's the way I decide which side that I go in for the lateral procedure is based on preoperative x-rays, the level of the rim of the pelvis. If it appears to be higher on one side, I would go in on the other side. Also, if there's a curvature in the spine or a scoliosis, typically you would want to go in on the side of the concavity or the side on the inside of the curve. So it depends, and sometimes depending on the angle of the disc. If the disc is angled a certain way, it may be easier or better to go in from one side versus the other. I'm constantly striving to develop new or to adopt new procedures that are less invasive, that are less disruptive, less risky, and that have very high success rates. So I'm very pleased that we currently have XLIF technology, and I'm excited about what new technologies there are in store for the future. That's one thing that's very exciting about spine right now, is that every year there's a new technology or advancement. But I definitely want to do things in the safest way possible for patients. Again, XLIF I think is a very safe, effective procedure with low risk, low infection rate, and I'm glad that I'm able to offer it to my patients.